Hi, my name is Jenny Humphreys, and I'm going to present to you the 5-stage theory of the grief process, Elizabeth Ross' theory of death and dying. Elizabeth Kubler Ross was a medical doctor, and she worked with refugees during World War II. She met with them in concentration camps and saw the death camps in Poland. And this inspired her to look more into the study of death and dying. Kind of moved towards her future career and is what motivated her to start looking into that. She moved to the U.S. in 1958 and trained as a psychiatrist. She went on to teach at the School of Medicine in Chicago, and she trained as a psychoanalyst after that. She ended up writing the book on death and dying in 1969, where she discussed her 5-stage theory. She is a 2007 inductee into the National Women's Hall of Fame. She was the recipient of 20 honorary degrees, and by July of 1982, had taught, in her estimation, 125,000 students on death and dying courses in colleges, seminaries, medical schools, hospitals, and social work institutions. In 1970, she delivered the Ingersoll Lectures on Human Immortality at the University of Harvard on the theme of death and dying. Here is a really great quote from her. "The reality is that you will grieve forever. You will not get over it. The loss of a loved one, you will learn to live with it. You will heal and you will rebuild yourself around the loss you have suffered. You will be whole again, but you will never be the same, nor should you be the same, nor would you want to." This one really spoke to me because I lost my dad when I was a baby, and I've always felt connected with him, but always felt the grief of losing him. It's not something you'll ever get over, and so I really think that this is a brilliant quote. The 5 stages of grief: denial, anger, bargaining, depression, and acceptance. The first stage is denial. Denial helps us to minimize our pain by not believing in the truth of our loss. Denial is also a way for our mind to take the time it needs to understand what is happening. Normal ways to feel during this denial stage are confused, you feel avoidance, elation sometimes even, shock, and you feel fear. The second stage is anger. Once denial starts to wear off, those experiencing loss and grief usually feel angry. They think, why me? They blame others. They blame themselves. They act out in various ways that reflect their anger.
I'm not ready to get out. I'm just going to do some,
This is a normal process, and it's important to feel it all. Knowing that even though it seems helpless, keep in mind that it will pass. Anger can help bring us back to reality after feeling disconnected from our denial stage. It can be necessary to name it as a tangible thing that one is going through, and this helps guide us into the next process, the next stage, which is bargaining. In bargaining, you feel so desperate to get your loss back, the loss, whatever it is, whether it be their own death or the death of a loved one. You want it back so badly that you feel like you would do anything for one more moment. This can be a way of getting out of reality, a way to skip all the feelings of grief. This is often accompanied by feelings of guilt and a lot of what-ifs. For example, one can tell themselves, if a loved one had died, they could tell themselves, if only I had been there, then this event would have never happened, say in the example of a car wreck. The fourth stage is depression. During depression, you feel feelings of emptiness. You feel like there's no point to go on. You feel sluggish and often find it hard to do ordinary everyday tasks, such as just getting out of bed in the morning. But this process does start the beginning of disconnection, which is something we must face in order to move to the next stage, which is acceptance. In acceptance, this is the stage where individuals come to terms with whatever event has taken place. One starts to realize that you can continue on with life. This does not take away the grief, but it allows the person to live within it in a way that allows for the individual to participate in life once again. You find your way back to a certain kind of normal. So why is this theory important to human behavior? Well, it's important because you need to be aware that what we're experiencing during grief is a normal process. It's easier to help others who are grieving when we understand feelings and inner experiences that they're going through during the grief process. In this video, Elizabeth Kubler-Ross speaks to the dying patient. Notice how she is connecting with the patient beyond words. She's not noticing how the patient, or she is knowing how the person is feeling and treating her with kindness and respect. It's a really great video.
I was totally alone. When I started this work, I was very much hated for sitting with. The thing for you right now is that you can't speak well.
Bringing the patient home to a familiar and loving environment provides more opportunity to counsel not only the patient, but also the family. Dr. Kubler-Ross believes that giving the final days of a loved one to their family significantly helps relatives cope with their grief.
She knows that she's going to die, but the process is taking a long time. And what is it that she's supposed to be learning through such a long process?
If you can regard this as a challenge and not as a threat or a punishment or something negative, but as a real challenge, like you're able to communicate with her all the time. You can learn to communicate like this with your husband, and with your children, and with me. And that's not so difficult. You know, as long as we don't fake it, that we understand you when we really don't. That is also a lesson for us. And that
I really loved that video because it showed just how important it is to be there with people in their grief and to try to have patience and understanding. John, you need to get her. I'm doing a presentation. Sorry about that. Okay. She changed the way people view death and dying. According to the EKR Foundation, Elizabeth Kubler-Ross on death and dying challenged the authoritarian doctrine and Puritanism of the day, which this was around World War II, in a period in which medical professionals spoke of advanced illnesses only in euphemisms or oblique whispered comments. Here was a doctor who actually talked with people about their illness and, more radically still, carefully listened to what they had to say, just as she did in the video we just watched. Social workers do play a role. In social work, we will most likely encounter those who are experiencing some form of grief, whether it's in a hospital setting, working with those who are facing their own mortality, or a child in foster care who's grieving the loss of their old school, their family, and their community. We're likely to be in situations where it would be helpful to consider this process they are going through. This can help us as social workers to act with patience, understanding, compassion, and empathy. And that concludes my presentation. Thank you.